Hello. Um, Welcome. It's a pleasure to be with you today here at the Roseman CODM Student Research Symposium. We hope that you and your families had a safe and happy holidays and were able to spend some quality time together. And if not, we're able to at least be there virtually and just like we are today. Anyways, my name is Alex Macdonald and my partner is Edgar Tilley. And we have done a research article / project on what's called orthodontic expenditures. I just want to give you a little background. So as we all know, orthodontics is the field in dentistry that diagnoses, prevents, and treats facial, dental, and occlusal anomalies. If orthodontic conditions are left untreated, these anomalies can lead to significant dental problems such as tooth decay and periodontal disease and other diseases, thus highlighting the importance of treatment. In addition, orthodontic treatment improves the aesthetics, and as such, the popularity of orthodontic cosmetic care is increasing today. With a population of almost 330 million people, each year only 9 million individuals in the United States receive orthodontic treatment. 75% of those who receive orthodontic care happen to be under the age of 18. Another statistic that varies widely is the fees, payments, and insurance coverages for orthodontics, which we'd like to talk about a little today in our paper. Insurance plans vary in their coverage services for orthodontic treatment. For example, Medicaid covers only a handicapping malocclusion due to birth defects, accidents, diseases, or abnormal growth patterns, or conditions that affect nutrition. The program CHIP, Children's Health Insurance Program, provides dental coverage which includes procedures deemed medically necessary to prevent disease, and promote oral health, to restore oral structures to the health and function, and to treat emergency conditions. Both CHIP and Medicaid leave the interpretation for necessity for orthodontic treatment up to the provider and each state. Medicare typically does not cover orthodontic services with limited exceptions such as to treat conditions resulting from disease or injury. Once again, kind of vague. Private insurances coverage for orthodontics procedures also varies and is generally comes to a greater cost for the patient. For example, Delta Dental is one of the private dental insurances that many know about, and their coverage is only about 50% of what dental treatment for orthodontics they could receive. Also, some other interesting things. Older reports indicate that most patients seeking orthodontic care were primarily uninsured or from a high income population. In a study done from 2010 to 2012, a study found that 56% of care for children was paid out of pocket, while children with public insurance only represented 9.4% of orthodontic visits. While some dental insurance plans offer full or partial orthodontic coverage for care deemed medically necessary, the lack of standardization for determining qualified cases creates disparities among case approvals. So, as you can see, I listed some of them here, and I just mentioned about some of their orthodontic treatments and their coverage, and sadly, it's not. A lot of it's vague, and so we wanted to talk about that in our research article. We have some graphs and other things in our research project. Covers 2 decades from 1996 to about 2016. And in this study, we examined the orthodontic expenditures, we examined insurance coverages, and we also wanted to explore the trends in expenditures. So to be able to help with this, we used the system what's called Medical Expenditure Panel Survey. And basically the MPS collects data from a single individual and for families in regards to demographics, health status, socioeconomic aspects, and access to care. And of course, we adjusted the dollar amounts to the year 2016 to account for inflation and deflation over the period of this study.
All right, everyone. So just like Alex had mentioned, we've used MEPS, the Medical Expenditure Panel Survey, for this research article. This report, they calculated and graphed across the following characteristics. So they looked at age, marital status, race, gender, income, insurance coverage amongst different providers, and what each individual person used or that a family used. So for the results that we found over the 16-year study, it almost doubled from 1996 to 2016. Along with this study, we noticed that there was a fluctuation within that expenditure report. And over these years, this suggests that orthodontic expenditures were sensitive to the economic environment within that year. And then just like we mentioned in a previous slide, MEPS was able to look at different characteristics between a family household or an individual. And these were some of the results that we had found. The graph on the left shows if they were self or family oriented, or if they were with insurances, and how they were able to use that expenditure compared with Medicaid or a private insurance. And then the one on the right was another example of different insurances that were used within those. When we look at these results, we look at the top left is broken down into age groups, and the age groups that were seeking orthodontic care at that time. So we see the majority was under the age of 18 years old. And this one's not broken down specifically into gender quite yet, but just those that were under 18 years old. The second most was those who were between the years of 18 and 64. The one on the upper right shows race and how race influenced the expenditure report. We see that the Asian population and the white population, they were actually pretty similar. With some years they fluctuated as well. And then lastly, the one on the bottom shows the difference between gender, the male and female. And we see those fluctuations as well throughout the years. For this discussion, we saw that throughout the study, out-of-pocket payments represented the largest expenditure, averaging more than 10 times greater than that of public insurances. So those graphs just showed that first slide set with the graphs with self-pay or family pay was far greater than any of the insurances that covered orthodontic treatment. Also, study results found that individuals under 18 years old exhibited the greatest orthodontic expenditure per capita. Again, another graph that showed those who were under 18 years old received the most orthodontic treatment. And then total orthodontic expenditures in the United States almost doubled from $11.5 billion in 1996 to $19.9 billion in 2016. So, like we previously mentioned, it almost doubled in the amount of expenditures between this time frame of this study. And then last but not least, from this conclusion, from the 1996 to 2016, the total orthodontic expenditures in the United States almost doubled. And then our research project and article shows that orthodontic expenditures are sensitive to the economic environment of the country. This results in the majority of those receiving orthodontic care to be those who can afford it on their own. Other disparities also exist depending on the patient's background, race, family life, and even insurance coverages. For example, 15% of the US population have orthodontic problems severe enough to affect function, but treatment is not covered because each state has its own policy that deems a particular procedure medically necessary, um, in comparison to something else like cosmetic or something. Despite the increase in orthodontic expenditures, orthodontic care falls short of meeting the needs of the community. Um, and so this was what our research study and our article um, covered throughout this time as we looked at the expenditure report over the last 16 years and how it has affected those with insurance coverages or out-of-pocket pay, and really those who are trying to seek orthodontic treatment and how it's affected them as well.